How to prevent physical diseases? Do you want to know how to protect yourself from common physical diseases and stay healthy? Discover practical tips and strategies to prevent physical illnesses and maintain a strong, healthy body. Now watch the video to learn more about physical diseases and how to avoid them. Introduction: Preventing physical diseases is crucial for maintaining overall health and well-being. As the saying goes, prevention is better than cure, and adopting preventive measures can help avoid chronic illnesses, reduce healthcare costs, and improve the quality of life. Understanding how to prevent physical diseases empowers individuals to take charge of their health and make informed lifestyle choices. Understanding physical diseases. Physical diseases refer to a wide range of health conditions that affect the body's organs, tissues, and overall functioning. These can include chronic illnesses like heart disease, diabetes, hypertension, and acute conditions like infections or injuries. The impact of physical diseases can be severe, leading to reduced mobility, decreased quality of life, and even premature death. Recognizing the importance of preventing these diseases can help individuals lead healthier, more active lives. Common causes of physical diseases. Several factors contribute to the development of physical diseases, including lifestyle choices, poor diet, lack of exercise, and unhealthy habits like smoking or excessive alcohol consumption. Genetic predispositions. Family history of certain diseases increases the risk of developing similar health issues. Environmental factors. Exposure to pollution, harmful chemicals, and infectious agents can lead to various health problems. By understanding these causes, individuals can take proactive steps to reduce their risk of physical diseases. The role of nutrition in disease prevention. A balanced diet is essential for maintaining good health and preventing diseases. Proper nutrition provides the body with essential nutrients, including vitamins and minerals, support immune function and cellular health. Antioxidants help combat free radicals that cause cell damage. Fiber promotes digestive health and reduces the risk of chronic conditions like diabetes and heart disease. Incorporating a variety of fruits, vegetables, whole grains, lean proteins, and healthy fats can reduce the risk of developing many physical diseases. Regular exercise as a preventive measure. Physical activity is a key factor in disease prevention. Regular exercise helps maintain a healthy weight, lowers blood pressure, improves cardiovascular health, and boosts the immune system. Different types of exercises suitable for preventing diseases include aerobic exercises, walking, running, swimming, for cardiovascular health. Strength training builds muscle strength and bone density. Flexibility and balance exercises, yoga and stretching to reduce the risk of falls in older adults. Engaging in at least 150 minutes of moderate intensity exercise per week can significantly lower the risk of chronic illnesses. Adequate sleep for optimal health. Quality sleep is vital for maintaining overall health and preventing diseases. Lack of sleep weakens the immune system, impairs cognitive function, and increases the risk of chronic conditions like obesity, diabetes, and heart disease. To promote healthy sleep, maintain a consistent sleep schedule. Create a comfortable sleep environment. Avoid screens and caffeine before bedtime. Adequate sleep not only supports physical health, but also enhances mental well-being. Stress management techniques. Chronic stress can lead to numerous physical health problems, including high blood pressure, heart disease, weakened immunity, and digestive issues. Effective stress management techniques include mindfulness and meditation, reduce stress hormones, and promote relaxation. Breathing exercises help lower stress and anxiety levels. Regular physical activity releases endorphins, improving mood and reducing stress. Managing stress effectively can protect the body from harmful physical and mental health effects. Regular health checkups. Routine health checkups are essential for early detection and prevention of diseases. Regular screenings help monitor vital health indicators like blood pressure, cholesterol levels, and blood sugar. Timely medical consultations allow for early interventions, minimizing the risk of severe complications. Avoiding harmful habits. Harmful habits like smoking, excessive alcohol consumption, and drug abuse can severely damage health and increase the risk of chronic diseases. Quitting these habits or seeking support to overcome addiction can lead to significant improvements in overall health. Maintaining a healthy weight. maintaining a healthy weight is critical to preventing obesity-related diseases, such as type 2 diabetes, heart disease, and joint problems. Balanced management involves balanced diet, rich in nutrients, regular physical activity, avoiding crash diets or extreme weight loss methods. Achieving a healthy weight can improve overall physical health and reduce the risk of various diseases. Hygiene practices for disease prevention. Good hygiene practices are essential for preventing infectious diseases. Simple measures like regular hand washing, proper food handling, and maintaining a clean living environment can significantly reduce the risk of infections and illnesses. Teaching children proper hygiene habits can establish lifelong practices for better health. Vaccinations for disease prevention. Vaccinations play a vital role in protecting against contagious diseases. Following recommended vaccination schedules helps build immunity, preventing outbreaks of preventable illnesses. Vaccinations are particularly important for children, the elderly, and individuals with weakened immune systems. The mind-body connection. Mental well-being is closely linked to physical health. Chronic stress, anxiety, and depression can weaken the immune system and contribute to various health problems. Practices like meditation, mindfulness, and seeking emotional support can enhance overall health and resilience against diseases. Educating the community. Awareness and education are crucial for effective disease prevention. Public health campaigns, workshops, and health screenings help spread knowledge, encouraging individuals to make healthier choices and adopt preventive measures. Conclusion: preventing physical diseases requires a holistic approach, combining a healthy lifestyle, regular medical care, and community involvement. By understanding the factors that contribute to diseases and taking proactive measures, individuals can lead healthier, more fulfilling lives, reducing the risk of chronic illnesses and maintaining overall well-being.